Welcome all. In this video we are going to discuss how to see a CT scan plate and how to make diagnosis. So this is a CT scan plate and let's see few basic things. That it is a slicing of the brain, okay? These images are slicing of the brain from the leg side to upper, okay, mean that here it is the base of the skull and here it is the upper portion of the skull, okay, and this image is taken from the leg side, okay, so it is the left side and this is the right side, okay, like a mirror image. Means you are standing on the leg side of the patient and you taking photos by slicing pattern of the brain, okay. Now see this CT scan and make a diagnosis. At first you have to differentiate between the hypodense and hyperdense area. The plate is black, okay, and means more the white it is more the hyperdense and more it is black means more hypodense. So these are the hyperdense area and this is the hypodense area, okay. Hyperdense area is mainly the skull bone, okay, and this is the hypodense area, okay. Now see in this X-ray in this CT plate, from this plate you can see here the hypodense area, here also the hypodense area, and hypodense area is getting bigger, okay. Then all these plates have hypodense area, okay. Then so it is a hypodense area on the left side, okay. So it is left side hypodense area, means hypodense area in the CT scan means there is a ischemia, okay, means obstruction of blood flow, and due to this here develops ischemia. So when you see a hypodense area you have to suspect the ischemic stroke, okay. So what to tell in this CT scan, that it here we can see in this CT scan left sided hypodense area ischemic cerebrovascular accident. Now next CT scan plate, see in this CT scan, see from here what is this, it is hypodense or hyperdense, it is hyperdense means more white means more dense, okay. So it is hyperdense area. Hyperdense signifies that there is a bleeding, okay, or any clot present. So see from this area, these are the hyperdense area on the left frontal side, okay, and you can see the shape of the hypodense area, the biconvex shape, okay, biconvex shape. So it is here the left sided biconvex hyperdense area means it is extradural hematoma, okay. The extradural hematoma, a significant feature is the biconvexity, and if you see carefully there is a thin hypodense area which denotes the edema, means the hematoma encircled by the edema, it signifies a extradural hematoma. Next CT scan, let's see in this CT scan, here is something, this type of what is hyperdense area, okay. Hyperdense area means here the convex and here it is concave. So concave convex area, here also you can see concave convex area. So one side is concave and other side is convex. This signifies subdural hematoma or subdural hemorrhage, okay. Let's see in this plate also, this plate also. So it is a subdural hematoma. So what you have to say, this is a CT scan of brain and here we can find a left sided concave convex hyperdense area which signifies a subdural hemorrhage. Now in this CT scan, let's see. So see in this city, no such finding, no such finding. Let's see here. Here a hypodense area, star-shaped hypodense area. Okay, star-shaped hypodense area. See the star-shaped hypodense area. Here also. So in this CT scan, you can see a star-shaped hypodense area, and it is not a typically a ischemic pattern. Okay, this is a star shape. It is probably a mass. Okay, with perilesional edema. In this area, perilesional edema, and you can see the shifting of midline towards opposite side. Okay, so what you have to tell? It is a hypodense area in the right side, probably a right-sided mass with perilesional edema. Okay, with midline shift towards opposite side. Now see this in this city, you can see here, so many hyperdense area, means here it is a diffused bleeding. Okay, and let's see the ventricles. The ventricles are more dilated, so dilated ventricles. So what is the diagnosis? It is a CT scan plate denotes the diffused bleed. It is probably a intracerebral bleed or subarachnoid hemorrhage, and here you can find a diffused bleeding with hydrocephalus, means the dilated ventricle. Okay, now see this CT scan. Here the hyperdense area means here it is a hemorrhage. So here it is a hemorrhage, and you can see the midline is shift on this side, means the left side, and these plates almost the level of the basal ganglia. So you can say there is a hemorrhage on near the site of basal ganglia. Okay, and probably a hemorrhagic stroke. Now see in this city, here a hypodense area, means here is a ischemia. Okay, so it is left side, so left-sided infraction. So it is a infraction, means hypodense area means ischemia due to, and which develops infraction. So here it is infraction. So left-sided infraction means hypodense area, probably due to ischemic stroke. Okay, now see this CT scan plate. Here a hyperdense area, more white, means hyperdense area, and in the peripheral portion there is a hypodense area. Okay, in the center it is a hyperdense area which is encircled by a thin hypodense area. Okay, so which denotes the edema. Okay, so what is the diagnosis? It is a hyperdense area encircled by the hypodense area. Probably it is a right side, so probably it is a right-sided hemorrhage with edema in the level of the basal ganglia. Okay, and now this CT scan plate. Let's see. In this CT scan plate, you can see here a hyperdense area. Okay, so it defines a intracerebral bleed. Okay, and here you can see the hypodense area. It is hypodense area. Okay, the hypodense area. It is not ischemia, it is gliosis. Okay, what is the gliosis? It is a reaction of the body to a brain injury. Okay, where the body produce more large ganglial cell to protect the brain. So it is gliosis following the injury or the intracerebral bleed. So that's all.